Hello, my name is Kris Campbell, and I am the Health and Wellness Specialist at Area 10's Endwright Center. Endwright Center is located in Ellisville in Wilmington, Indiana. What I do there is I do a lot of different things, but I do teach some balance classes and some classes that we call SBF classes, which stands for Strength, Balance, Flexibility. So obviously in those classes, we are working toward helping people to improve their balance and to prevent falls. And as you can tell by the name of Strength, Balance, Flexibility, is we do work on warming up, doing some strength exercises for your whole body, doing some stretching, flexibility exercises for your whole body. And we also work on some things specific to balance. And that may be everything from just standing on one foot to walking around like you're walking on the line, lots of different types of things that we'll do as far as for balance, physically speaking. But we also do some other types of exercises because one part of balance, one very important part, they're all important. The strength is important, the flexibility is important. We work on posture exercises quite a bit, but also something that is important is your vestibular system and improving the functioning of your vestibular system. And when I talk about that, what does that mean? Well, that is the system in your ears that helps you know where your head is in position in relation to the ground. So it lets you know whether your head is upright or whether your head is one side or the other or up. So it kind of lets you know what your position is. And sometimes you struggle with that for whatever reason. So we're going to talk about that a little bit today and see if we can show you some exercises today to help you improve the functioning or make your vestibular system work better. And so I'm not going to focus on strength. I'm not going to focus on flexibility. That's all another class. But we will talk about how to do some of these other exercises. So I'm going to start out with, a lot of people come to me asking me questions about, obviously they're having issues with their balance, or maybe they're having issues with being dizzy or having vertigo maybe. And so I want to start with a couple of definitions. One, the definition of dizziness. If you're dealing with dizziness, usually that's considered feeling lightheaded, feeling unsteady on your feet, feeling fatigue, or feeling just uneasiness. Some of the symptoms that may accompany that is feeling faint, feeling like you're losing your balance, or you're feeling heavy-headed, or you're feeling like you're floating. So some of those that would be considered feeling dizzy. All kinds of causes why you can be feeling dizzy. And so some of those, we're just going to mention those. A big one for this age group is medications. Some of the medications might be affecting that. You may have just general motion sickness from moving. Inner ear disturbances, which we'll talk about some more here in a moment. Dropping in blood pressure, going from a seated position up to a standing position, having a concussion, some neurological conditions, low blood sugar, low iron levels, also dehydration or being overheated, or having carbon monoxide poisoning. So all of these types of things could be reasons why you might be having issues of dizziness. So another definition is something that people will sometimes say that they suffer from vertigo. Vertigo is kind of like a more specific type of dizziness. And with vertigo, what a person might be feeling is a feeling like the room is spinning, or they are spinning, or maybe they're being pulled side to side, maybe they're swaying. They can't quite, they just really have just an off feeling. And that's a little different, like I said, than the dizziness. And some accompanying symptoms they may also have along with that is feeling nauseous, or feeling like they're having sweating, headaches, hearing loss, ringing in the ears. So very important to know. And sometimes all those words are kind of used interchangeably too. But important to know what you're dealing with exactly, and also what are reasons for why you're having the symptoms that you are. As we get older, we do deal with more of these types of symptoms, but good to know. If you're just dealing with some minor issues of dizziness, maybe even some minor vertigo, What I'm going to do today is show you some exercises to try. So this would be like a DIY for these issues, for these symptoms. However, if you try them for a while, you notice that they're not getting any help, and especially if you feel like you're in danger because your symptoms are so severe that they're causing you to feel unsafe, you should definitely go and get some professional help, some help with your diagnosis of what it is exactly, what is causing your symptoms, and maybe some professional help with that. There are some things that they can do medically speaking, physical therapists and osteopaths, other physicians and health practitioners that can do things that can help. But I do want to help you here with just some basic exercises you can do to improve the system functioning and see if we can improve your balance and you're dealing with dizziness or maybe vertigo. Okay. So I want to start out with some exercises, like I said. And the first one, the first type of exercises are something that we call vestibular compensation exercises. And what vestibular compensation is that, like I said, your brain, your ears have the organs that are helping you with your balance, your balance organs in both ears. And if something isn't working properly, maybe there's the imbalance in between them, or maybe there's damage to one of them or both of them, and it's not working correctly. So what we want to do is we want to teach the brain to learn to rely on some signals from some other body parts. So it might be your neck, it might be your feet, your ankles, your eyes. So your brain learns to rely on these other signals as well to help you maintain your balance and know where you are in space. Okay. So how we're going to do that is that we're going to be working on just trying to help you get your neck and your shoulders to relax. I'm going to train the eyes to move independently of the head and how to work independently of the head. Practicing good balance, something I won't really show you today, but just to remind you, practice good balance in every little thing that you do during the course of your day and your situation that you're in, to practice good balance and good posture. Practice head motions that cause dizziness, especially if you're dealing with dizziness. What are the positions and the motions that are causing you dizziness, if that's the case, and to practice those and to get your body used to how to accommodate and how to compensate for that. And then just improving your general coordination. And when I'm talking coordination, I'm talking about coordination between your head and your ears, and your head and your eyes, and just your whole system working better together. So I want to show you some of these exercises. I will have to refer to my sheet once in a while because I don't remember them all exactly. So the one thing to do is I'm going to take you through tell you how to progress through them. So we're going to start with sitting, and very important before you start these is to make sure that you are in a place where you feel safe, in a comfortable position. You don't, maybe even have something to hang on to next to you, whether it's a chair or something, especially when you go to the stand-up exercises. You're not going to fall and hit your head on something. So the idea is not to fall, obviously, but I do want you to feel safe and comfortable. So you're going to start in a sitting position. And the first one and we're going to have some toys too. So I'll be showing you some toys, as we go here, some balls. I'm going to have you have some balls and some pins maybe. So if you want to go up and grab those now, because I would really like it if you would go ahead and do these with me today. And then you can go back through and you could watch the tape again and learn these exercises really good. So you might have to have a neat pin today or two, a tennis ball. You happen to have a card that has some words on it, or maybe you want to go ahead and make some letters on it on the back, something that you can see. I know that's backwards to you all, but if you actually even have a balloon, it gives you a good excuse to go buy yourself a couple of balloons. Good thing to have handy. So if you have any of those, or if not, you can gather them up later. You can watch me gather them up later. So the first thing we're going to do is sit up straight. And looking straight ahead, we're just going to bring our shoulders up to our ears and then relax them back around and down. up to the ears and around. So every time before you start your exercises, go ahead and relax. Bring those shoulders up and around and down, and just relax those shoulders, relax that neck. All right. So I want you to find something across from you to focus on. And if you have something you can put on your wall or on your refrigerator door, someplace in front of you that you can kind of focus on it. And so you're always going to come back. When I say come back to your focus point, that's what I mean. I mean, come back to what you're focusing on. So get your head and your face focused. And then what you're going to do first is you're just going to, with your eyeballs only, don't look, with your head, eyeballs only, you're just going to start going left to right. Just look left to right. As you get to where this is okay and you're feeling okay with this, go a little faster. All right, go back to your focus point. All right, so the same thing now we're going to do up and down. So focus, and then eyes up and down. All right, back to your focus point. Once in a while, you may have to blink your eyes a little bit and realize that doing these exercises may make you be a little dizzy during class or during the exercises or even afterwards. Relax with that. Try to work through it as much as you can. Don't put yourself in an unsafe situation, but try to realize that you may become more dizzy before it starts helping you become, your body gets used to it and your brain starts getting used to the idea here. So, so sit up straight again. And the next one we're going to do is put our finger out in front of us. It can be your pen, it can be whatever you want to use. And we're just going to focus on it out in front of our face about 3 feet out. Then we're going to bring it in. We're staying focused on that fingernail. Bring it out. Bring it in. You can move it around different places. Head stays still. Rest that arm. You can do the other arm. And once in a while, you can stop and just rest your eyes. Three feet out, back in. All right. So blink your eyes again. Just relax your eyes. So another one that we're going to do is you're going to get used to the idea of turning sideways, or not turning, but reaching sideways and picking something up off the floor. Again, it's your picking up, looking down, looking back up, picking something off the floor. Do the same thing forward, look down at the floor, come back up, look around the room, make sure you can you're still not dizzy. Down we go, back up. Doesn't have to be a very quick motion. If you get lightheaded with this, slow it down. Get used to it before you speed it up a little bit, okay? So be very careful if you have a blood pressure drops. All right. So another one that I like to do is grab yourself a ball. And there's a bunch of different ways to do this actually. But one thing I start with people is just to basically toss the ball back and forth, hand to hand. You can do it watching the ball. You can do it looking at your focus point. See if you can just do it with your hands. I also have them to sometimes bounce the ball and catch it. It's good to have another ball around just in case you lose the one ball. Bounce the ball, catch it if you have one that will bounce. You can also take it under your legs. I like to do figure eights, but you can just go under the legs. You're trying to get some coordination here with your hands talking to your brain. So move balls around. Okay, so there's also one you do above your head. Above the head one's kind of hard to do, especially if you're going to let go of the ball. So what I have people do sometimes is instead of using a ball, is to get themselves a balloon. Good reason to go buy a balloon. And just do the balloon. sitting, and you're tapping that balloon up in the sky above your head. And your eyes are following it. You don't have to tap it off your head. That's just me. But just go ahead and play with the balloon. You may feel silly. This is actually an exercise to get your brain used to keeping your head balanced. So you can do the balloon as another part of your routine. Okay. So as you get to where those are getting easier, another thing to do is then to progress into doing them standing. So if you're going to do them standing, what I would highly recommend is to have your chair, have a chair close to you, so you have a handle close to grab a hold of if you need to. You might start with your feet shoulder width apart, and again do the same exercises that we did earlier, the up and down, or eyes side to side, eyes up and down. And I don't know remember if I did the head side to side, head up and down, but if I didn't, that's the second one. So it'd be eyes up and down, eyes side to side. And it would be head up and down, head side to side. Right, and all of those, you're going to be coming back to the center focus point when you're done. And then if you want to progress again, what you would do is you would put one foot in front of the other, kind of offset like this. So your one foot would be back and one foot would be up. You could do the same thing. Okay, so side to side, up and down, that's eyes, eyes and then head. And if you get to where that's too easy, you can actually put one foot in front of the other. So you're standing like this with one foot exactly in front of the other. Same thing, eyes side to side, eyes up and down, head side to side, head up and down. And as you get better at it, you get to where you go faster. Now realize that's the progression, okay? That's after you've done it sitting for quite a while. So if it's too easy sitting and you feel like you're ready to stand, you stand safely. You may progress to where your legs together. You may progress to having one leg out, legs in front of each other. Okay, so that's all the progression. Same thing with the balls and the balloon. You may stand up, you may play with the balls, the balloon, put your legs in front of the other. Okay, so that's the progression of those exercises, all right? So always being very careful. You can even, as you progress more, walk around the room. In my class, I have lines on the floor, or sometimes we have an imaginary line and you walk the line. And as you're walking the line, you're moving things, moving your hands, moving the balls, putting the balls behind your back and things. So you can do those types of things, just being very careful again to do those types of things if you're by yourself and not putting yourself in danger. So that's the progression. Another way to work on the same vestibular system compensation is to do things, activities during the course of the day that where you're having to move around and also look at objects. And even sporting events are great for this too. Sporting activities and I guess I should say recreational type of activities, but things like bocce ball, bowling, horseshoes, maybe even up to pickleball or ping pong, types of things where you have to move, but you also have to have your eyes following things. So picking something like that that's fun, that you enjoy, not something that's going to be unsafe for you, but just progressing through some of those, finding something like that would be another great way to do. Dancing while you're doing your housework might actually work the same way. You know, dancing, you're wiping the windows, dancing, you got your sweeper going. So movement and eye movement at the same time. So that is some of the exercises and things you can do to help you with your vestibular compensation, to help possibly with your balance and also with your dizziness and maybe even with your vertigo. Now with the vertigo, possibly some other issues going on there, so it may end up needing to be checked out, but at least it would be worth a try to go ahead and try some of this and see if it helps. So again, being very careful with those progressions, with all those exercises. And I want to go ahead and tell you about another thing that you can do. And the other thing is called gaze stabilization exercises. And with what we're trying to do with gaze stabilization is we're trying to improve your vision and also in trying to improve your ability to focus on objects while you're moving your head. So what you're going to do here too is the same thing. You're going to start seated. And this is where I said you're going to start with your either your card that has something on it that you can look at, some words or a picture, something that you can get a good focus on, or you might even just have a pen. Eventually we're going to have 2 pens possibly, but so you have your pen or you have your card, it doesn't really matter. And you're going to first put it out in front of your face, hold it with your hand. Okay, so with your eyeballs focused on that card or on that pen. Okay, so keep your eyeballs focused on the tip of it there. And then you're going to turn your head side to side, keeping your eyes focused on the pen. Try to go faster, but it's very important that your eyes stay focused on the pen. If you start getting dizzy, you may need to slow down and then progress a little bit slower. But as it gets easy to do, go ahead and speed up. And if it keeps getting easier, keep going. So you may only do it 10, 15 seconds this first time, but you may get to where you're doing it 30, 35 seconds. See if you can get to where you can do it for a minute. All right. And then after that, you might rest your eyes. You may just focus for a moment. And then you're going to go to the next one, which is the same thing with the pen. But this time we're going to be looking up and down. So you're looking at your pen tip again, and your eyeballs up, eyeballs down, back and forth. I'm sorry, I said eyeballs, head up and down. Got off track again, sorry. But what you're going to do is you're going to hold the pen out there, eyeballs are on the pen, head goes up and down. And if it gets easy, go faster. As it gets easier, continue on, try to build up that time to where you can do that for a minute. The longer you go, the better it is for your system to get used to what you're doing and to make that change. All right, so once you're done with that, take that breath, nice deep breath, relax those shoulders again, especially if you're getting tight. You might want to bring your shoulders up and around again. A couple of nice deep breaths during all of this is always a good thing. And anytime you're taking a nice deep breath, take a breath in through your nose, out through your mouth. So 1 or 2 of those every once in a while during this, help you relax a little bit. So this next one, what we're going to do is we're going to take the pen, still the same one pen or same one card, and we're going to turn our head and take the pen with us so that we're keeping our eyes focused on the pen again. Back to straight ahead. All right, very good. And that one, go ahead and get your balance again if you got a little off. And we're going to now have 2 pens, or I do quite a bit is I use my little smiley face for my pen a lot of the time, 2 drumsticks, and you can use whatever you want to use, like I said. So take your 2 pens or your 2 drumsticks, and what you're going to do is you're going to put them in front of your face, about 10 inches apart from each other, and your vision is straight ahead. So you're still looking at your focus point. So you put one up above and one below your focus point, and then keep your eyes straight ahead at first. And then you're going to go back and forth looking at the top one, the bottom one. Back and forth, focus, back and forth. Your head stays still. And go as fast as you can, but make sure you get good focus on both. And if you want to use cards, use a card or a pen, like I said, 2 pens. Okay, bring back down, nice deep breath. Now you're going to go vertical. Okay, so again, you're looking forward at your focus. Your pens are out to the side. And same thing, eyes are going to go back and forth. And faster, if you can go faster. And then relax. All right. So what we've done is we have worked some vestibular compensation exercises, some gaze stabilization exercises. And I apologize if I missed that one going through that first time. So basically what that first one was, again, that vestibular compensation was, I want to just remind you here, is that we are going to, first we're moving our eyes up and down and back and forth. It doesn't really matter the order. So you go back and forth, you go up and down, up and down. The second one is you move your head side to side, a little faster, and up and down. All right, and then you progress from there with those. Go through all the exercises, and anytime you need to, like I said, stop, take a break, relax those shoulders. Close those eyes for just a moment, let them rest. Take a deep breath. Continue on. I would recommend those first set of exercises that I did, the stabilization, or the, not stabilization, the compensation. I would do those once or twice a day, every day. We do them with my balance class, but we usually meet 2 or 3 times a week, and I recommend to them to go ahead and do those every day, once or twice. And the ones that are the gaze stabilization, same thing. Do them every day. Do them 2 or 3 times. Do 15 to 20 in each set. Maybe even getting up to that 1 minute. Those ones, 1 minute. So the more you can do them, the better. The more you can move around during the day, the better. The more you can challenge yourself with looking away, looking back to something close by, looking away again, looking close by. Don't spend all day just looking at one thing that's only this far away from you, especially if you're somebody that stays on the computer a lot or does something with your hands like knitting or sewing, and you're just looking at one thing for a long time. Make sure that you're getting up every half an hour, walking around the room, looking at things that are far away, looking back at things that are close, and letting those eyes move. And the eyes have muscles, and helping them to move. And like I said, doing some of those activities. And they're a lot of fun too. Go play some putt-putt golf. Come play some pickleball. Go do some bowling. Go do some bocce ball. Go do some shuffleboard. Do some disc golf. There's lots of different things out there you can do. And those types of activities, not only are they fun and a good way to get outside, get some exercise, but they're also a good way to keep your balance and your systems all functioning as well as they can. All right. So like I said, if you do some of these exercises and you've done them for a couple of weeks and you don't notice that they're helping, and especially if you start doing some of the other balance activities as well, the strength and the flexibility things, if you're not getting some good relief from your dizziness and your balance issues, I would recommend going ahead and getting checked out. So very much thank you for joining me today. I'll give you my name again. It's Kris Campbell, and I'm at the Area 10 Endwright Center in Ellettsville in Bloomington, Indiana. And feel free to look me up. If you would have questions, I'd be happy to answer your questions. And I highly recommend that you take a class, whether it's someplace else or with us, a balance class, even maybe a Tai Chi class, a yoga class, dance class, anything that gets you moving and gets your eyes moving. It's going to be good for you, good for your balance. Good for your overall health and wellness. So look me up, look us up. We'll get involved with your local activity center and have some better balance and some less dizziness. All right.